Prenatal screening. Can you get a false negative? Have you ever wondered about the accuracy of prenatal screening tests? Many expectant parents relying on these tests to assess the health of their baby. But can these tests sometimes give misleading results? Let's break it down. Prenatal screening can indeed produce false negative results. This means the test may indicate that everything is normal when, in fact, the fetus could have a genetic condition. This is true for several current prenatal screening methods, including non-invasive prenatal testing, which examines fetal DNA fragments found in the mother's blood. False negatives happen because prenatal screening tests are not diagnostic. They provide probabilistic assessments rather than definitive answers. For instance, non-invasive prenatal testing has a high sensitivity for detecting common chromosomal abnormalities like trisomy 21, trisomy 18, and trisomy 13. In ideal conditions, it can detect over 99% of cases. However, a small percentage of affected fetuses may be missed, leading to false negative results. The false negative rate for non-invasive prenatal testing is generally low, estimated between about 0.02% and 0.26%. However, for certain conditions like trisomy 18, studies have found false negative rates around 7 to 8%. Several factors can contribute to false negatives in prenatal screening. One factor is low fetal DNA fraction. This means the amount of fetal DNA in the mother's blood may not be enough for accurate detection. This can be especially true for mothers with a high body mass index or those who are early in their pregnancy. Another factor is confined placental mosaicism. Since non-invasive prenatal testing analyzes DNA from placental cells, differences between placental and fetal chromosomes can lead to discordant results. This can cause false negatives or false positives. Technical limitations also play a role. Variations in laboratory methods, sequencing depth, and bioinformatics analysis can affect how accurate the tests are. Additionally, some chromosomal abnormalities may only be present in a subset of fetal or placental cells, making detection more complicated. Given these limitations, it is important to interpret prenatal screening results carefully. A negative screening result does significantly reduce the likelihood of common chromosomal abnormalities, but it does not completely eliminate the possibility. If ultrasound findings suggest anomalies, or if there is a high-risk clinical history, further diagnostic testing may be recommended. Tests like chorionic villus sampling or amniocentesis directly analyze fetal cells and can confirm or rule out genetic conditions. While prenatal screening tests like non-invasive prenatal testing are highly accurate and helpful for assessing fetal genetic health, false negatives can occur. Understanding these limitations is essential for families and healthcare providers to make informed decisions about follow-up testing and pregnancy management.